Have you ever heard someone say, "I don't feel sick, I'm just getting older"? Or maybe even said it yourself? That simple sentence is one of the most dangerous beliefs when it comes to type 2 diabetes in older adults. Because here's the truth. Diabetes rarely starts with pain. It doesn't hit you like a sudden fever or a broken bone. It doesn't make you collapse or scream. It whispers. It hides behind common, easy-to-ignore signs. It feels like normal aging, until it's not. Why is diabetes so sneaky? Because in its early stages, high blood sugar doesn't always hurt. It just wears you down. You might get thirsty more often, go to the bathroom at night, feel a bit more tired than usual, lose a few pounds without trying, get blurry vision now and then. None of that sounds dramatic, right? That's why millions of people over 60 ignore the signs. They think it's just aging or stress or poor sleep. But inside your body, something serious is happening. And if you ignore it, high blood sugar starts damaging your eyes, your kidneys, your nerves, your heart. By the time real pain shows up, it may be too late to prevent complications. That's why early detection matters so much. And that's why I want to take you on a journey through the 15 subtle signs of diabetes in older adults. Some may surprise you. Some might even sound like what you or a loved one is experiencing right now. Please don't ignore them. Let this video be your wake-up call, or a gift of awareness for someone you care about. Imagine waking up in the middle of the night. Your mouth feels like sandpaper. You drink a full glass of water, then another, but still, you feel dry. You think, maybe it's just the weather. But what if it's not? When blood sugar levels get too high, your kidneys go into overdrive to flush the excess glucose out through urine. That process pulls water from your body, leaving you dehydrated even if you're drinking more than usual. This isn't just being a little thirsty, it's persistent, unusual, and disruptive. You might notice needing water several times during the night, carrying a water bottle everywhere, dry mouth that doesn't go away, feeling lightheaded from mild dehydration. Many older adults chalk this up to, "I'm just getting older, I must not be drinking enough, it's just hot today." They don't realize this is one of the earliest red flags of rising blood sugar. Frequent urination. It's not just aging. You've probably heard someone say, "I wake up 2 or 3 times a night to use the bathroom." That's just what happens when you get older. But what if that's not the whole story? One of the most common early signs of diabetes is frequent urination, especially at night. This isn't the occasional bathroom trip. It's needing to go multiple times every single night. Sometimes every hour. It disrupts your sleep. It leaves you exhausted during the day. Why does this happen? When blood sugar is too high, your kidneys work harder to get rid of the excess sugar. They pull more fluid from your blood, creating more urine. And that cycle continues. Drink more water because you're thirsty, then urinate more often. This constant loop is one of the body's earliest warnings. The problem is, many people in their 60s or 70s dismiss it as just a part of aging. But ignoring it means missing a key clue your body is trying to give you. Don't wait until it becomes unmanageable. Pay attention to your nightly bathroom habits. They might be saying more than you think. Losing weight without trying might sound like a dream, especially for older adults who struggle to stay fit. But in the case of diabetes, unintentional weight loss is a red flag, not a victory. Here's what's happening. When your body can't properly use insulin to move glucose into your cells for energy, it begins to look for alternative fuel. It starts breaking down fat and muscle to keep you going. This leads to weight loss, even if you're eating normally. You might notice looser clothing without changing your diet, shrinking muscle tone, feeling weaker or more fatigued despite eating enough. The scary part? Many people see the number on the scale drop and feel relieved. They don't question it. But sudden, unexplained weight loss, especially more than 5-10 pounds, can be a sign that your metabolism is out of balance due to high blood sugar. It's your body's quiet cry for help. If you or a loved one has lost weight without trying, don't ignore it. Ask why. Because sometimes the answer leads to early diagnosis and a chance to turn things around. As we get older, it's normal for our eyesight to change. Reading small print might get harder. We may need more light to see clearly. But when your vision suddenly becomes blurry, especially if it comes and goes, it could be something more serious. High blood sugar affects the fluid levels in your eyes. It can cause the lens inside the eye to swell, changing its shape and affecting your ability to focus. You might experience sudden fuzziness when reading or watching TV, difficulty focusing that improves after rest or hydration, headaches from straining your eyes, fluctuating vision, clear one moment, blurry the next. These aren't just signs of getting older, they're warning signs that excess glucose is interfering with your vision system. If left unmanaged, this can lead to long-term complications like diabetic retinopathy, glaucoma, even vision loss. But caught early, these effects can be stabilized, even reversed with proper blood sugar control. Don't assume blurry vision is just a part of aging. Sometimes, it's your eyes trying to tell you something about your blood. Have you ever felt a strange tingling in your hands or feet? Like tiny pins and needles? Or a dull numbness that comes and goes? Many people ignore these sensations, brushing them off as poor circulation or just sleeping in the wrong position. But in reality, this could be diabetic neuropathy, early nerve damage caused by high blood sugar levels. Over time, excess glucose in the blood damages tiny blood vessels that supply the nerves, especially in the extremities. This can lead to tingling or burning sensations, numbness or decreased sensitivity, pain or sensitivity to touch, weakness in the legs or feet. It usually starts in the feet and moves upward, a pattern often called stocking distribution. Left unchecked, this can lead to serious complications, loss of coordination, foot ulcers, even infections that may lead to amputation in extreme cases. What's scary is that this damage can begin even before diabetes is officially diagnosed. So if you or someone you love experiences unusual sensations in their limbs, don't wait. Get screened. Early detection can save nerves and lives. Everyone feels tired from time to time. Maybe you didn't sleep well. Maybe you had a stressful day. But the fatigue that comes with diabetes is different. It's deep, relentless, and hard to explain. Many people with early-stage diabetes report feeling exhausted even after a full night's sleep, needing naps during the day just to function, struggling to concentrate or stay alert, a constant sense of being drained no matter what they do. Why does this happen? When glucose builds up in the bloodstream instead of entering cells, your body is essentially starving for energy. Even though you're eating, your cells aren't getting the fuel they need, so your body slows down. It's like pressing the gas pedal, but the tank is empty. This kind of fatigue often sneaks up gradually, making it easy to overlook or blame on age. But if you've noticed that your energy has dropped dramatically, especially without a clear reason, it's worth asking your doctor for a blood sugar test. Because sometimes fatigue is more than just being tired. It's your body waving a red flag.
Have you been getting sick more often lately?
Or notice that small cuts and scrapes take longer to heal. This could be more than just aging. It might be a sign that your immune system is being compromised by high blood sugar. Diabetes affects how your body defends itself. When blood sugar levels are high, it weakens the immune response, making it harder to fight off infections and recover from wounds. You might notice recurring urinary tract infections, frequent skin infections like boils or fungal rashes, gums that are swollen, red, or prone to bleeding, cuts or sores that stay open for weeks instead of days. For older adults, these issues are especially serious. A small infection can turn into something dangerous if not caught early, especially if nerve damage, neuropathy, makes it harder to feel pain or irritation. And the worst part? Many people treat the symptoms but miss the underlying cause, diabetes. So if you or your loved one keeps battling infections, don't just reach for another round of antibiotics. Ask your doctor, could this be linked to blood sugar? Because the sooner you know, the sooner you can act and protect yourself.
Losing a few pounds might sound like a good thing,
especially if you haven't changed your diet or exercise routine. But when weight loss happens suddenly and without reason, it's often a red flag. In people with undiagnosed diabetes, weight loss can occur even when you're eating normally, or more than usual. Why? Because your body isn't using glucose properly. Instead of converting sugar into energy, your body starts breaking down fat and muscle for fuel. This leads to rapid weight loss, muscle weakness, a thinner appearance, especially in the face and limbs. Feeling hungry despite losing pounds. This type of weight loss isn't healthy. It's your body saying, I'm not getting what I need. For older adults, sudden weight loss can also increase the risk of falls, frailty, immune system decline, poor wound healing. If you or someone you love is losing weight without trying, especially when combined with other signs like fatigue or thirst, it's time to investigate. Don't ignore it. Sometimes, the number on the scale is telling you more than you think.
Have you or someone close to you been feeling more irritable lately?
Quick to anger, overwhelmed by small things, or constantly anxious? While it's easy to blame these emotional changes on stress or aging, fluctuating blood sugar levels can have a powerful effect on mood and mental well-being. When blood sugar is too high or too low, the brain doesn't receive the steady stream of energy it needs. This can lead to sudden mood swings, feelings of irritability or restlessness, trouble focusing or making decisions, increased anxiety, or even symptoms of depression. What's tricky is that these emotional changes often happen before diabetes is diagnosed, making them easy to dismiss. Some people may even say things like, I just don't feel like myself lately. Everything seems harder than it should be. I get upset over the smallest things. For older adults, these shifts can also be confused with early signs of cognitive decline. But in some cases, it's the result of unstable blood sugar. The good news? Once diabetes is managed, many people report feeling more emotionally balanced and mentally sharp again. So if emotional health feels out of sync, it's worth considering that your blood sugar, not just your circumstances, might be playing a role.
Do you find yourself scratching more often lately?
Or noticing that your skin feels unusually dry, tight, or flaky, even if the weather hasn't changed? Dry, itchy skin is one of the most commonly overlooked symptoms of diabetes. Why does it happen? High blood sugar pulls fluid from cells, leaving your skin dehydrated. At the same time, poor circulation caused by diabetes reduces blood flow, especially to the legs and feet, making it harder for the skin to stay nourished and healthy. You may notice persistent itchiness, especially on the lower legs, cracked or peeling skin around heels or elbows, flaky patches that don't go away with lotion, increased sensitivity or discomfort after bathing. In some cases, itching may also be related to fungal infections, which are more common in people with high glucose levels. Many older adults assume dry skin is just part of getting older, but if it's new, intense, or resistant to treatment, it might be worth looking deeper. Because sometimes, what seems like a minor skin issue is really a sign of something happening deeper inside your body.
Have you found yourself reaching for snacks more often?
Even after a full meal? Do you feel like you're eating more than usual, but still not satisfied? This could be a warning sign of diabetes. The medical term for this is polyphagia. Excessive hunger caused by your body's inability to use glucose properly. Here's how it works. Even though your blood sugar levels are high, the sugar isn't entering your cells the way it should. Your body thinks it's starving, so it sends signals that you need to eat more. This leads to constant cravings, especially for carbs and sweets. Eating large meals but still feeling unsatisfied. Gaining or losing weight rapidly despite your diet. Feeling tired or sluggish even after eating. And it becomes a vicious cycle. You eat to get energy, but your body still can't use it properly. For older adults, this symptom is often mistaken for emotional eating or dismissed as a change in appetite due to aging. But if increased hunger appears alongside other signs like frequent urination, fatigue, or blurred vision, it's time to get tested. Because the problem isn't your willpower, it's your blood sugar.
Do you ever feel a strange tingling in your fingers or toes?
A numbness that comes and goes, or maybe a burning sensation that wakes you up at night? These aren't just annoying sensations, they could be early signs of diabetic neuropathy, nerve damage caused by high blood sugar. Over time, uncontrolled diabetes damages small blood vessels that nourish the nerves, especially in your hands, feet, and legs. When this happens, your nerves struggle to send signals correctly. You may notice tingling or pins and needles in extremities, numbness that makes it hard to feel textures or temperatures, burning pain, especially at night, sensitivity to touch or even mild pressure. At first, these symptoms might come and go, but without proper treatment, they can become permanent and even lead to serious complications like foot ulcers or infections. Many older adults dismiss these sensations as just poor circulation or part of getting older. But nerves don't just tingle for no reason. If these sensations have become part of your daily life, don't ignore them. Your body may be whispering something important. Check your blood sugar now.
Do words on a page seem fuzzier than before?
Have you noticed it's harder to focus when reading or driving, especially at night? Changes in vision are one of the earliest yet most underestimated signs of diabetes. High blood sugar can cause the lenses in your eyes to swell, changing their shape and how they focus light. This can lead to blurred or cloudy vision, difficulty focusing on close-up or distant objects, double vision in some cases, eye strain or headaches after reading. What's more concerning? Over time, uncontrolled diabetes can damage the blood vessels in the retina, a condition known as diabetic retinopathy, which may lead to permanent vision loss if left untreated. It often starts silently, without pain or dramatic symptoms. Many older adults simply update their glasses prescription, without realizing the root issue is blood sugar. But here's the hopeful part. In the early stages, these changes are often reversible once blood sugar is managed. So if your eyesight has changed recently, and especially if it's happening alongside other symptoms on this list, get it checked out. Because your eyes may be seeing something your body's been trying to tell you all along. Have you been getting sick more often than usual? Battling recurring infections? Whether they're urinary tract infections, skin issues, or slow-healing wounds? This could be your immune system sending out an SOS. Uncontrolled diabetes weakens your body's ability to fight off germs and heal properly. High blood sugar levels can suppress immune response, making infections more likely. Feed bacteria and yeast, especially in warm, moist areas like the mouth, underarms or groin. Delay wound healing, especially on the feet or legs. Increase inflammation throughout the body. For older adults, this often shows up as frequent urinary tract infections, UTIs, gum disease or mouth sores, skin infections or rashes, cuts and bruises that take too long to heal. Many people write these off as just getting older or having sensitive skin. But when infections become frequent or stubborn, it's time to dig deeper. Because a strong immune system starts with balanced blood sugar. And when your body is constantly under attack, it deserves the chance to fight back with the right tools and support.